Okay, great. So my name is Julia Dudley. I'm the MaineMOM Data and Quality Manager. And Kate Ahrens is on the call with us today, and she's an associate research professor at the Muskie School of Public Service. And as Lisa had mentioned, she does our birth certificate and Medicaid linkage for our mothers and infants. Let's see here. Here we go. So I did want to give a little bit of background of maternal OUD and NAS in Maine. So from 1999 to 2016, just like the rest of the country, Maine saw a big boom in maternal OUD and neonatal abstinence syndrome. And so for maternal OUD, we saw a 50-fold increase, and neonatal abstinence syndrome, a 30-fold increase. From 2016 to 2022, this was just recently published. Maine saw a decrease in maternal OUD and NAS. For maternal OUD, we saw a 47% increase and a 58% decrease for neonatal abstinence syndrome. And so researchers are hypothesizing, why the decrease? And a true decrease could be related to improved access to family planning care. So that's related to long-acting reversible contraception or increased education for providers. So that would lead to better access to evidence-based treatment for mother-infant pairs that were affected by opioid use disorder. So evidence does show that access to healthcare is the most effective way in connecting women that are pregnant and postpartum who are dealing with opioid use disorder or any substance use disorder to recovery services. And we pulled this quote from a qualitative study that looks at factors that promote resilience and recovery in women that are dealing with substance use during pregnancy and postpartum. And I'll read it here. So I was an emotional mess, but it was the nurse because, the list of regular questions that they have to ask. And one of the questions is, do you use drugs? And I started bawling. I was like, yes, that's why I'm here. And she said, it's all right. You can talk more about it when the doctor comes in. She was super nice about it as well. I had planned on telling them on my own. But then when she asked, I was like, oh, well, this makes it much easier. I can just tell them the truth. That's what I'm here to do so that I could get the help that I needed. So MaineMOM, just like the other 8 or 9 states that participate in the MOM model, otherwise known as the maternal opioid misuse model, aims to improve the integration and coordination of maternal care and opioid use treatment from prenatal all the way through 12 months postpartum. MaineMOM first enrolled a patient in 2021 and since has served over 200 individuals. I believe February 2024, we saw 208. So we've enrolled 8 new moms as of 2024, which is really exciting. And then MaineMOM was established as a Maine Care service in December of 2023. So the federal evaluation will end at the end of this year, and MaineMOM will be picked up as a Maine Care service. So for this analysis, we looked at birth record data from in-state live births, Medicaid enrollment, medical claims, and pharmacy claims data. And we also looked at MaineMOM enrollment data. And so the birth record data had previously been linked for a prior analysis to the Medicaid and MaineMOM enrollment information. And this allowed us to look at mother-infant pairs. So from January of 2021 to September of 2023, we had 14,500 Medicaid enrolled women at the month of delivery. The majority of those women did not have OUD during pregnancy. 764 of those women did have OUD, but they did not enroll in MaineMOM. And then we had 154 who did enroll in MaineMOM and delivered. So 117 of them enrolled during pregnancy and 37 during postpartum. And so this table will show characteristics that are related to substance use disorder among the women that were Medicaid enrolled at the month of delivery. And here we have those 4 groups of women, right? No OUD, OUD, never enrolled in MaineMOM. And then our last 2 columns, we have MaineMOM enrolled during pregnancy and then during postpartum. So we looked at opioid use disorder and found that not all of those enrolled in MaineMOM had an OUD diagnosis in the Medicaid claim. We looked at cannabis use disorder and found this to be quite high among women with OUD across the board. highest among those that enrolled in MaineMOM during pregnancy. Nicotine use disorder we also looked at, and again, across the board, high among women that have OUD, highest among those that enrolled in MaineMOM during postpartum. We looked at alcohol use disorder as well, found that this is quite high among women with OUD across the board. We did have to suppress this. So if you see that tiny little E in that cell, that means that the count was too small to show. So we had to suppress that for women that enrolled during postpartum, but quite high among the other groups. And we looked at cocaine use disorder and found an extremely high rate among women that enrolled during pregnancy in MaineMOM. For sedatives, hallucinogens, and inhalants, we found quite low rates of this. And again, we had to suppress a lot of those because they were so small. And then finally, other stimulants we looked at, and this does include caffeine, and it showed high percent among women that enrolled in MaineMOM, roughly 30%. So this is a continuation of that same chart. So again, these four groups of women, and here we're looking at the use of medication for opioid use disorder during pregnancy. And for women that enrolled in MaineMOM during pregnancy, we found roughly 87% were on a medication for their opioid use. Compared to women that enrolled during postpartum, it was significantly higher. We also looked at bloodborne infectious disease diagnoses, hepatitis B and C. Hepatitis B was quite low across the board, but hepatitis C was quite high, roughly 45% for women in MaineMOM. So this will show infants of MaineMOM participants and those that have linked to women that do not have OUD and those that have OUD not in MaineMOM. So you'll see that the counts are a little bit lower, but it's just because these are the infants that linked. So for gestational age, we found that for infants that were born to women that were enrolled in MaineMOM during pregnancy, they had similar gestational age compared to those without OUD. This is true for birth weight as well, compared to the other two groups of with OUD not in MaineMOM and with OUD that enrolled during pregnancy. We looked at low birth weight and found this to be low among women that enrolled during pregnancy, and quite a bit higher for women that had OUD not in MaineMOM. We also looked at preterm birth, so this was birth before 37 weeks, and found this to be really high among women that enrolled in MaineMOM during the postpartum period, but lower for women that enrolled during pregnancy compared to women that had OUD not in MaineMOM. This is a continuation of that table, looking here at the neonatal opioid withdrawal syndrome diagnoses in the Medicaid claims. So we found for infants that were born to women in MaineMOM, roughly 66% of those infants were diagnosed with NAS or NOWS, compared to 50% of women that had OUD not in MaineMOM. We also looked at foster care enrollment in the first 6 months of life, and I believe these were for infants that they did not have Medicaid for the entire duration, or for, I'll have to ask Kate at the end of this presentation, but in our next analysis, we hope to refine this a little bit more, and we suspect that these numbers could even go up. So for women that enrolled in MaineMOM, or infants that were born to women that enrolled in MaineMOM, this rate is really high, 23% for women that enrolled in pregnancy and 38% for those that enrolled during postpartum. Here we're looking at, again, the women of the analysis and looking at disease testing during pregnancy. We looked at syphilis testing and found this to be quite high among women in MaineMOM, but slightly lower compared to those with OUD not in MaineMOM. We also looked at Hep C testing and found this to be pretty high across the board and highest in women that enrolled in MaineMOM during pregnancy. So this figure shows the prevalence of OUD at delivery hospitalization from 2021 to 2020, September of 23. You can see that these white Hancock and Saginaw we had to suppress because the counts were so small. But those in the light gray, the prevalence of OUD was between 4 and 6%, and the dark gray is 6 and 10%, between 6 and less than 10%. I will say that this is related to where they gave birth and not where they lived. And so on our next analysis, and when we update this, we really want to look at residence. And so where are these women living, and where do they concentrate? This is looking at the proportion of days covered with medication for opioid use disorder during and after pregnancy among women with opioid use disorder. So in the blue, we're looking at women with OUD that never enrolled in MaineMOM. In orange, women in MaineMOM during pregnancy, and those that enrolled in MaineMOM during postpartum are in gray. So, and this is between 2021 and 2022. And so for pregnancy, women in MaineMOM had the highest percentage or proportion of days covered with medication for opioid use disorder. And then in postpartum, that rate was highest among women that enrolled during the postpartum period. And lastly, we looked at well child care visit attendance among infants in Maine that enrolled in Medicaid at birth by mother's opioid use disorder status. So we have 4 groups of women here. Our first over on the left is women with no OUD, women with OUD not in MaineMOM, and then our 2 groups at the end are those that enrolled in MaineMOM either during pregnancy or postpartum. And so our blue bar shows the postnatal visit. So 100% of all women or all infants born to these women had a visit within 0 to 14 days following the date of birth. And then that 1-month visit, we put that down as 15 to 41 days. And so women that enrolled during pregnancy, their infants had the highest rate of attendance for those visits between that time period. And then finally, we looked at the 2-month visit, and we found this rate to be pretty similar across the board for women with OUD not in MaineMOM and those without OUD, as well as those that enrolled in MaineMOM during pregnancy. However, we see that those that enrolled in MaineMOM during the postpartum period, their infants did have lower rates of attendance to that 2nd month visit. So in summary, from 2021 to September of 23, we had 154 women that delivered and were enrolled in MaineMOM. 117 of them enrolled during pregnancy and 37 during the postpartum period. We found that not all MaineMOM enrolled women had an OUD diagnosis. So this may indicate gaps in documentation of OUD among Medicaid enrolled women. We found that more MaineMOM enrolled women had MOUD and had higher proportion of days covered with MOUD compared to women not in MaineMOM. And this could be and is likely related to MaineMOM using a medication first approach to treating OUD. We also found higher rates of NOWs among MaineMOM enrolled infants. This is likely related to MaineMOM women being more likely to take and adhere to medication for opioid use disorder. So this could the increase in NOWs could be related to an increase of exposure in prescription opioids in utero. And then finally, other literature has suggested as well that medication for OUD listed in the mother's medical chart could act as an indicator to providers that the infant needs to be tested for neonatal opioid withdrawal syndrome at delivery. We also found finally the well child care visit attendance was highest among infants whose mothers enrolled in MaineMOM during pregnancy. And this is likely related to the benefit of the MOM model and increased provider engagement. And it could also be related to increased rates of NOWs among infants enrolled in MaineMOM. So in conclusion, these findings suggest that the MaineMOM care model does have a positive influence on several outcomes for MaineMOM for women and infants affected by OUD, particularly for women who enroll in MaineMOM during pregnancy. So that's what I have for you today. We're super excited to hear your feedback and any of your questions.